I want to talk to you, Senator Cannizzaro, about this fact that Speaker Frierson was making in his TikTok, quoting from the L.A. Times. 40 years ago, women made up 12% of state lawmakers nationwide. Today, women hold nearly 2,300 of the roughly 7,400 legislative seats nationwide, or just over 30%. But that's a whole different story in Nevada, where women make up more than half the legislature.
Thank you so much for having me, Ali. And that's right. In Nevada, we have over half of the legislature is comprised of women legislators. And as the speaker mentioned in his incredible TikTok, we also have a large number of women who are serving in leadership positions. They're serving as chairs of legislative committees. They are serving in leadership positions in both the state Senate and also in the state assembly. And I think when you have those voices sitting at the table, you can accomplish all the things that were mentioned in the speaker's TikTok video and more.
And Speaker Frierson, let's talk about the bill that you sponsored, and this was, or you authored. This is the expansion of mail-in voting, universal mail-in voting. You know, I talk to secretaries of state all over this country who are saying these voting restrictions are a solution to a problem that doesn't exist. Mail-in voting has been used, has been proved. It's been used with the military for over a century. It actually works and causes more people to vote.
It not only it works, it causes more people to vote. We had a record turnout with our elections, and we had actually built up on what we did last special session. Of course, during COVID, you shouldn't have to choose between your health and being able to vote. But we took what we did in the special session, made it more safe, more secure, provided more training, and we found no fraud in our state. We found no systemic fraud. And so we've had some of the best election officials in the country, and we want to make sure to help them help more people vote.
And let me ask you, Senator Cannizzaro, about the bill that you authored, which was about a public option for health care. This is one of those things that a lot of people are really frustrated with, that we've not been able to expand that part of Obamacare, which Republicans have tried to gut. I've lost count of how many times they've tried to do it. People need better access to health care, and you've decided to address that head on in a place like Nevada, where people are very concerned about this.
Yes, and that is exactly why this was such a critical piece of legislation this time around, Ali. We have in Nevada a persistently high uninsured rate of around 11%. That's 350,000 Nevadans, and we still rank in the top 10 of states for the uninsured rate. Yet we are one of those states in that top 10, one of the only ones that actually did expand Medicaid with respect to the Affordable Care Act. And so this is a persistent problem that not only is backed up by the data here in the state, but is also something that we hear all the time when we talk to constituents at the doors, when we see them out in the community. And I think it's been really highlighted by the pandemic, where so many people lost their jobs. They struggled to find insurance coverage. When they went to go get additional insurance coverage, they found that it was just too expensive. And so what the public option is seeking to do in Nevada is to leverage the state's purchasing power to bring in some federal dollars and help buy down the cost of premiums so that people can actually afford access to health care. And built into that, we have some bidding preferences and some incentives for insurers who can actually provide that value-based care, so we can ensure that people are actually getting access to medical care that they need and not having to worry about if their child gets sick, are they going to be bankrupt, and do they have to make the choice between that and their child's health.
Do you have some projection as to, of that 11% uninsured, what this could drop that to?
We don't have a projection of how much that would drop it to, but we have paired this piece of legislation with some actuarial analysis that we're going to do over the next bit of time in order to ensure that what we are doing is building network adequacy, because that is a huge piece of it, ensuring that the plans that we're offering are going to make Nevadans covered under all of the needs that they have, and also to buy down those premiums over time. And that is what we're seeking to do. We're seeing that if people can afford health insurance, it's not as though they don't want to be covered or they want to be individuals who end up in the emergency room for very acute injuries or advanced diseases where they're getting more expensive, uncompensated care. We want to make sure that more people are getting insured. And because that 11% exists, we know those are folks who aren't qualifying for those subsidies. We have populations of individuals who are retired who don't yet qualify for Medicare and can't find access to affordable coverage. So we're hoping to make a good dent in that uninsured population. And I think that actuarial analysis that's paired with the bill will help us to do just that.